I wanted to make a video about a possible cause of MALS syndrome besides genetic abnormalities. I'm not a doctor, although I have always researched alternative medicine and alternative perspectives of health, which are very important in order to figure out advancements and to think in a different way, as they say, think outside of the box. I'm not accredited. My phone just froze here. I'm not accredited, but I hope you'll consider my idea here. I'm not the only one that's thought of it. Doctors have thought about it as well during conversation, so I'm not alone in this idea. There's multiple ideas, but let's say that TV is funny. Let's say that you have a prolapsed GI, mesentery. Let's say EDS syndrome causes your skin to stretch, connective tissue to stretch, and your GI prolapses. That pulls on your aorta, pulls on your arteries, and so your ligament gets altered from an anatomy change and pulls. Think of an intelligent design. That ligament pulls in to hold that aorta, pulls in so that the GI is not pulling on your aorta and causing additional problems. And you'll notice that with MALS syndrome, you also have nutcracker syndrome associated with it as well. And the reason may be because of connective tissue. And one possibility is a prolapsed GI, so everything's shifting. Possibly, right? And as I read in, you hear that a lot of these MALS patients have autoimmune and connective tissue weakness from EDS, which makes you suspect that prolapses and connective tissue weakness causes MALS and not just genetic disorders. Genetic, being born with MALS. And the idea is that if you could say genetic in the case that the autoimmune connective tissue weakness through poor genetics caused it to begin with, right? Or led up to it. And that's why people don't see symptoms until further down the road in their life. But nowadays, I have to agree with Dr. Morse. You're seeing kids with these conditions, people in their 20s and younger. And Dr. Morse has been saying this for years. I can't say that I agree with everything he says, spiritually and physically. But I will agree that children and people my age, 20s or so, are having a lot more issues because of the endocrine system. And Dr. Morse's perspective is that when the endocrine system is down and the kidneys are down, the body produces more acids or holds on to acids and causes connective tissue weakness. And thyroid, connective tissue. Thyroid is associated with the structure of the body. So it makes you think that MALS syndrome is essentially a side effect of something else. And to prevent it, you need to find what's causing it. And it's funny because before I got sick, I was always telling people, take care of something you have now so it doesn't become an additional problem when you have an injury. Or take care of it now before it becomes worse. And it's like cause and effect. One last idea that a surgeon, a lot of people are going to absolutely hate this one, but it kind of makes sense a little bit here, is that you have an injury to your chest and it affects your diaphragm and the anatomy of your chest and your spine. And it causes that ligament to cave in or to pull in on that artery. Just any anatomy change at all. And I've heard other people in the MALS group, you do have to consider this. This is not just, I'm going to look at blood and genetics and what I'm seeing. You have to look at historical records and what's happening to people in order to get the full story of what's causing this. And I've heard from multiple people that they've had car accidents or a wrestling accident or some sort of sports injury, such as myself, multiple sports injuries on top of autoimmune connective tissue weakness, ultimately leading to MALS syndrome. So whether I figured this out in my life, I'm hoping I do, whether or not I do, I want to make sure this information gets out there for you that is researching MALS. That you can solve this. I believe structural breakdown is caused by infection and acids and endocrine system issues, and genetics, but I believe genetics can be maintained thanks to epigenetics. Although some people believe it's a new age perspective, it's also common sense that if you smoke cigarettes, you're going to give yourself cancer. Or you lack vitamin D, the enzymes in your body are not going to function as properly, and you're going to turn DNA on and off. The same could be caused for anatomy issues as well, in my perspective. Anyway, I hope that helps somebody. Going to make some food and get some rest and then keep researching in order to hopefully save my life. I had an injury to my chest and my spine, ultimately leading up to MALS as far as I can tell. I didn't have any MALS symptoms, but I had autoimmune my whole life, and it caused GI issues, and those GI issues just coincidentally led up to MALS syndrome on top of these injuries. I hope that helps. Take care. And God bless.